Hi everyone, my name is Rachel. I'm the registered kinesiologist on staff with Physio Supplies Canada, and today we are going to do a training video on our brand new brace, the GENU-TEX ACL. Here is a close-up look at the brand new brace. So right off the bat, you're able to see that there is quite a lot of support given in this brace. You have 2 straps above the knee as well as 2 straps below. These support the hinges that are located on the sides. So this brace is basically a soft orthosis version of the rigid frame braces that a lot of patients use post or pre-ACL surgery. Like I mentioned before, this brace is specifically for ACL injuries, more specifically for the return to sport aspect. So because of the hinges, they are plastic. So the plastic actually allows this brace to be worn during contact sport. So the idea behind what Sporlastic was trying to go for was the fact that they could get a lot of support similar to that of the rigid frame brace while being able to train in this brace as well as play contact sports. Because the GENU-TEX ACL is a soft orthosis, it aids in increasing proprioception as well as reducing pain and swelling, and it also improves circulation around the knee joint. This brace comes with an anatomically shaped patellar pad. This fits perfectly around the patella. There is also protrusions that sit over both of the tendons that connect the quadriceps to the patella. It also has muscle stimulation points on both the medial and the lateral wings of this specific patellar pad, and this actually helps trigger the muscles in the quadriceps to help recover the knee in any way possible. Now I'm going to go into more detail about the hinge that is inside our new GENU-TEX ACL. So as you can see, the hinge is perfectly enclosed within the brace, so there's no issue of it poking out or touching the skin in any way. This is really beneficial for those people who are using this for sport. So you open up this flap that seals it in, and this opens up where the hinge is. It snaps in from this piece right here. There is a piece that snaps in just to make sure that the hinge stays in place. You snap it off, and then you're able to pull the whole hinge out of the brace. So this is what it looks like. It also has a rotary aspect to it as well. So you're able to get not just a flexion extension movement within the knee and guidance in that front, but you also get a little bit of guidance in the rotary aspect of the knee. Again, very beneficial for people who are using this for contact sport. So this brace and this hinge can be limited, so you don't need any tools to make the limitation aspects into place. All you need to do is twist this part open and remove it, and then you'll be able to see right here. This one right now is set to flexion max, so there's no limitation, and there's no limitation on the extension either. So it comes with pieces in the brace, and they easily pop out, which I'll show you in a second. But for the flexion extension limitations, for extension, it goes from a limitation of 0, 10, 20, and 30. And for flexion, there are flexion limitations of 0, 10, 20, 30, 45, 60, 75, and 90 degrees. Now I'm going to demonstrate for you guys how to remove the limitation blockers. So they come with a bunch of pieces like this, and on each one it is marked which you're doing. So this one it says 45F, and so this is going to limit 45 degrees into flexion. So in order to remove it, you just have to turn to the back side. You'll see there's 2 little orange pieces, and that's where you're going to connect this piece right here and just force it out. So I'll show you what that looks like. You put it over the new piece, snap it in like that, and this piece just comes right out. So this one was the full flexion, it didn't limit anything, and we are going to now put in the 45 degree. So you find that spot right here, you insert it like this, snap it in, and then now you have it this way. That's going to limit the flexion into 45 degrees. And lastly, before you put your new hinge that you've limited to whatever degree you would like back into the hinge. You're going to put this cap that we took off at the beginning back on. So to do that, you place it over these 2 points, and then you just rotate it and click it into place. You'll know where to put your fingers because there are little pads on this side and this side, which shows you where to put your fingers when you twist it to take it off. So now that you have done one side of the hinge, you're going to want to do the exact same thing to the opposite side. So you're just going to repeat the process and take out the hinge from the other side. There's always going to be 2 of the limitation pieces, so you just have to find the other one that matches the one that you used, and you can insert that into the other hinge, doing the exact same process. Lastly, the hinges and the splints do actually come pre-anatomically molded. In the case where you do need to adjust it based on the patient's different anatomy, these can actually be thermoplastically molded based on the needs of the patient. The GENU-TEX ACL comes in 7 sizes, and it's also important that you specify if you need it for the left or the right leg. Again, thank you guys so much for tuning into another Physio Supplies Canada training video on one of our Sporelastic products, and make sure you like and subscribe so you never miss a training session.